I'm ready.
I'm ready. So please tell me, why did you choose Tria? What was the attraction to our brand?
So a couple of years ago, I had, this is before I actually even became a dermatologist. My parents had both done laser hair removal. Had a very good success doing this in the clinic. And they had noticed that, like, after a few years after they had done it, the hair started to come back. And it was really expensive at that time. This is before laser hair removal, and the office was more affordable. It's more affordable now, but it's still extremely expensive.
Right.
With some places being the cost of the device per session. Okay?
Right.
So I was like, well, let me do some research. This is when I was in college. And I came across this device and a couple of other devices. The other devices, I won't mention the names per se, but they were light-based devices, so LED light-based devices, and I found this device. And I had, at that time, been working with a dermatologist who was explaining to me the laser in her office, which was a diode laser. And I was like, I feel like I think they sell that, over the like you can buy it.
Yes.
And so I put the connection together, and I read some articles at the time, and I was like, well, let's just order it and see how it is. I was like, what's the worst? It doesn't work. So mom and dad got it. My dad was using it specifically for the area under his eyes and his ears, and my mom was using it mostly for the upper lip and chin, and it worked. And then I was like, this is so interesting. Then I went into dermatology, and then I found out, all about laser hair removal. I worked with laser hair removal experts in Boston at Mass General Hospital, as well as where I did my residency training. And after learning the physiology and the anatomy of laser and hair anatomy and laser hair removal techniques, I now know that it is the best available, purchasable in-home treatment for unwanted hair.
Right. I agree with you.
That's how I came across Tria. Yep. That's how I came across Tria.
So talking about our laser specifically, this is our green Tria laser. This is the 4X. This is an award-winning device. We've won many awards for this. What features of this laser do you find useful for
Okay, so so I really like that it has a built-in cooling system, so it kind of, you'll hear the schmoozing of the device.
Yes.
It does. The good thing is you don't need protective eyewear, which is good because the laser is focused so specifically in the area. That's helpful because in the office when you're using a diode laser for hair removal, we do use eyewear because the laser beam can reflect off of surfaces because it's targeted in an area on the skin, and a lot of light is actually reflected back, and so it can damage the eye. So that's really good that it's very focused to a specific point, and you don't need laser and you don't need goggles.
Yeah.
That's one thing. No
goggles. I love that. No sunglasses in your house.
Nope. Another good thing is that you can adjust the setting towards how comfortable you feel. So this is something that I tell people, you can't be a baby when you're doing this type of stuff because you want the response, but you also want it to be semi-comfortable,
Right.
It has to give you a twinge, but it shouldn't be like, oh, I cannot handle unbearable pain. So I like that you can adjust the setting according to your comfort level. And obviously, I'm assuming that the greater number you go up on the device, the greater the energy that is delivered to the area, which will give you the better result. So that's another thing that I like. I like that it's also cordless because a lot of the other devices are not cordless and you have to plug them in. I like how elegant the device is. It's very compact. It's very easy to use. Very easy. Yep. And I like to turn off. Oh, yeah.
It has a good weight to it, but it's not something where I'm getting tired using it.
I think it's like a salon.
Yeah. I love this design.
Yeah.
It is the best.
Yeah, and it's like you said, it's not heavy. It's probably, I don't use hair dryers, but it's probably like an industrial sized, hair dryer. It's not heavy.
Yes. Yeah, I would say yes. It's maybe a slightly heavier than a hair dryer, depending on the brand that you get.
Yeah.
Maybe like the Dyson hair dryer weight.
Yeah.
But yeah, I love the design of it. It's really nice. It looks like, a lot of people say it looks like a giant Apple AirPod, actually.
Yes, it does
Which is funny because we were out way before Apple AirPods. So I
Yep.
wonder who stole the design.
Yep.
Yes. So who are the best candidates for our laser? I know that our laser only works on pale, like very pale, like me, to tan skin with light brown to black hair. But can you just describe a little bit about why it only works on those skin tones and hair colors?
Yes. So actually, this is kind of like the process, in laser, we call it selective photothermolysis. So
Mm-hmm.
we're using a laser, okay, to target a specific chromophore or target in the skin, right? So our designated target with the diode laser and most hair removal lasers is melanin, because melanin is what is in hair follicles, and that's what the laser
Mm-hmm.
uses to kill the hair, okay?
Right.
So the thing is, when you have melanin in your hair and you have a lot of melanin in your skin acts as a competitive target for that hair follicle, melanin. So I would say, like, my mom and my dad are my skin type, maybe slightly a little bit darker. I'm what they call a Fitzpatrick skin type 4. I think for a 4 to mid 4.5, the device is safe to use. This is, so this is in contrast to the other devices which are available that are not diode lasers, that are light-based devices, which cannot be used on darker skin types like myself because there's a high risk of burning. Because it's it's not a laser, it's not specifically targeting a chromophore. We're
Mm-hmm.
using light that targets melanin but also has peak targets of other things, and so it might target blood vessels, it might target pigment. So
Mm-hmm.
those devices you will burn.
Right.
So I would say, because we have the best example that I can explain it is, the laser works best in people who have the most contrast. For example, like you said, light skin, dark hair. So people with black, brown, dark blonde hair will get a good response. White hair, red hair, and fair blonde hair will not respond to this laser.
Okay, yes. I'm a natural redhead. Can't tell now. But I have like a multicolored body hair. I have blonde, I have black, red, all kinds of, and I have white, like stark white. And it's so weird. It's like a rainbow of colors. So I know
Yep.
that the laser won't work on certain hair colors on me. So that's where I find a lot of roadblocks for me to use this. But
Yep.
it'll get the
However,
black hairs very
yep,
nicely.
it does work well for people who are blonde and redhead, because the areas like the armpits and the groin typically tend to have darker hairs because they're much
Right.
more coarse, so the amount of melanin is larger. So if you're looking for something to treat just those areas, I think it's something fair to try. And you probably could use it in someone who's blonde and redhead normally on their head, but if they have darker hair in their armpits or groin, those areas would respond well.
Okay, we are getting some questions. We will answer the questions that are coming in at the end, guys. We do have a couple more questions left before we get to viewer questions. Okay, so we're going to talk about laser versus IPL. I know there's a lot of companies with IPL devices that are, advertising that it's a laser. It is not a laser. It says it's an IPL laser. That's not correct. So how do you feel about IPL versus laser? Can you tell us a little bit about how those two compare?
Yes. So to make things simple for everybody, and this is the way I think, right? Because lasers, it's physics, right? It's a lot of physics. So
Right.
basically, a laser has certain properties. Okay, you have to have a laser medium, a laser beam, a target that absorbs that laser. The light in the laser has to be collimated, or it has to travel in a parallel fashion. It has to be continuous. So we call them the C's of being a laser.
Mm-hmm.
IPL is intense pulsed light.
Right.
So the pulsations that you see is actually pulses of regular light. So visible light is the light that you see that comes out of your LED lamps or your, light bulbs and whatever. The way IPL works is it uses different, you basically pick different filters of the light spectrum to get your target. So you can use a filter to target red things, which are blood vessels. So that's why people with
Mm-hmm.
rosacea come in the office and we do IPL. It works great.
Okay.
For people who come in with, photo aging or freckles and brown spots, it works well because we have a filter for that. Just like that, there's a filter for hair, and it's a filter that basically also targets melanin. The problem is anytime you're using something with a filter, you can still catch other things. So it's
Yeah.
not a specific, it's not a laser because there's no specific target. And you have multiple targets that can be targeted with that laser light. It's not coherent. It's not continuous. There's no laser beam. There's no laser medium. So it's light. It's light that is highly concentrated with bulbs in a specific range. So it is not a laser. It works very well for certain things like blood vessels and brown spots. But the devices that are targeted for hair over the counter, like I said, very high risk of burns and unwanted side effects because you may be targeting other things as well that you intentionally may not want to target, and that can give you a higher risk of side effects.
Oh my goodness,
So,
yes.
and I will tell you, a lot of laser spas use IPL to treat hair. And I always recommend if you're going to get laser hair removal, go to a board-certified dermatologist. You don't go to a plastic surgeon because they cut. Their job is to cut. They're very good at what they do. They're not good at lasers. You don't go to a person who is not someone who studies laser anatomy, physiology, physics, and hair chemistry and hair physiology because you're doing yourself a disservice. Because, like I said, think of the IPL as going to a pan-Asian restaurant, where they have sushi, Thai food, Chinese food, and everything. Nothing's going to be good because they don't specialize in any one thing, right? That's how I think about it. When you pick a place to eat ramen, you know their ramen is going to be good. You don't go there for teriyaki or whatever.
Right.
So that's how I think about it.
For our specific device, it takes about 3 to 6 sessions to see results. And we recommend treating once every 2 weeks. Now, I have customers coming to me saying, Krista, I use this every day. And I'm like, no. Can you explain to the viewers why you should not use this every day and why it should only be used every 2 weeks?
You should not use this every day because the hair follicle has different phases of growth: anagen, catagen, and telogen. Anagen is the growing phase of the hair. So when the hair is growing, you have to make sure that's why. And the hair cycle can be up to 2 weeks for certain people. So once you hit the hair, anything you're doing after that isn't doing anything. You're not going to get a better response because you killed the hair.
Yes.
So all you're doing now is burning your skin. Okay? So you're at risk of getting burns, dark spots, light spots, and scars because the target that you wanted, you already treated. So you're not doing any extra to yourself.
Okay. Now,
so you really need to
set this.
Yep.
Because there are a lot of customers that go ahead and they take our instruction booklet and basically just throw it in the trash and do whatever they want. There's specific reasons why you cannot treat every day or 3 days a week or make up your own rules because there's specific reasons why we say we recommend every 2 weeks, one time.
Yep.
So, yeah. And so a lot of people also think that this laser is instant. Like tomorrow they're going to wake up and be a hairless dolphin, So can we talk about why it's not instant, why it takes so long? And we talked about the hair growth phases.
Yep.
So go ahead and explain why it's not overnight.
So I will tell you, anybody who ever promises you any advice that's going to be overnight, whether it's a dermatologist, whoever it may be, they're lying to you. Nothing happens overnight. Rome wasn't built in a day. Obviously, the same thing with our hair. We have gone through multiple evolutions in our lifetime to have hair as a protective thing. It's a protective feature,
Right.
It's protecting us. It has a hormonal role, endocrinologic role, thermoregulatory role, and we have stem cells that live in our hair, okay? And when we're using the laser to kill the stem cells in the hair where the pigment-making cells are, they don't just go away. We have to make sure that those cells stop reproducing. And so that takes multiple treatments of frying, those cells to get to that point. And I'll also mention laser hair removal is not permanent, right? The FDA says that laser hair removal is actually semi-permanent laser hair reduction. The goal is to make the hair thinner, less fine, less coarse, and for a lot of people that ends up being permanent for a certain number of time. But the stem cells wake up and they come back and they start growing again. That's why people still need touch-ups. So laser hair removal is not permanent. The reason why you have to do it is because our body is very intelligent, and we make stems. Every organ in our body has stem cells. The hair also has stem cells, and you can't just, zap it and expect those cells to die instantaneously. It takes a number of treatments. For some people, it could be 8. For some people, it could be 10. Everyone is different. Even with in-office treatment, it's a minimum of 4 to 8 treatments. I don't promise anything less than that.
Right.
Depending on your skin color, it depends on a lot of things. The energy you're treating at. So if you're treating it at the intensity that, you're getting that tinge, you're probably going to respond faster. If you're darker and, you want to be more careful and you're being slightly more less aggressive with the treatment, it's going to take longer. So it depends on how you treat yourself, your skin color. It's a lot of different factors.
You could tell me or the viewers that have PCOS, anything that you know about PCOS and why the laser isn't permanent for hair growth?
So majority of the patients that I see for hair removal, I will tell you, are a combination of patients with PCOS, which is very distressing because it's not just a skin disease, it's an endocrine disease. I also see a lot of patients who get folliculitis, which is irritation of the hair follicles in this area, often seen in men. People who obviously want to treat, their groin area, the bikini area. And then I see a lot of transgender patients also who, want to get rid of facial hair, which is very important for them for, sexual identity and also for surgical needs. So it's very, it's very sensitive to go to somebody if you're not comfortable getting treatments done like this, especially in different cultural backgrounds. Often with PCOS, it's not just hair on the face, it's hair in other locations too.
Yeah, other locations, yeah.
So it can be very expensive, to treat all these areas. And so it's great to have a device that you can do at home in your own personal space. And that's why I tell patients, I was like, if you're somebody who if you have the financial means to come see a doctor and you're not shy, and you want quicker results, sure, come see me. If it's not in your budget and you still want something, I don't believe in no treatment. If someone needs treatment, if people want treatment, as my job, an ethical duty to tell people that there are things that they can do that are affordable. This is something that's great for people to do. But if it's enough for a woman to get rid of what people would consider a beard, that's a big deal. The only permanent solution for patients with PCOS is electrolysis, where basically you go to you go to an esthetician who is a master in this. It is not done by a physician. It is done by a master in electrolysis, and they basically individually singe the hair follicles at the root. It also takes multiple treatments, but it is actually permanent. It's extremely painful. It also can be expensive because it's billed usually by time and area.
Wow.
But some people get the improvement that they want with the device like this because they can do it in the comfort of their own home. So they have motivation. They buy it, so they have motivation to do it. They don't need to be shy. They can treat a lot of areas that are often sensitive and, don't comfortable showing to certain people, even if they are doctors. I understand. Yeah,
we do have a lot of customers that have made amazing videos on their transformation with PCOS where they absolutely have no hair anywhere, and I'm just like stunned. It looks so beautiful, and their lives have been changed drastically by this at home this little guy.
Yep.
So I always say, try it first, see how it goes. Literally you can do it whenever you want at your own time, but make sure to do it once every 2 weeks, like clockwork. Don't miss any sessions, because then you might miss that growth phase that you need.
Yep, I agree. Yeah. Yep, absolutely.
Alejo P. Garcia, he wants to know, or he or she, I can't tell, wants to know if you can use the device over tattoos. We say no tattoos.
So that's a great question. This device, so again, tattoos have a pigment in them, which is going to compete with the laser as a target because there's pigment in the tattoo, pigment in your hair, pigment in your skin. So you can get not only, you can start removing your tattoo, you could get a scar and you could get a blistering burn, which will leave a scar. So I would not recommend treating an area over any tattoos. Similarly, over any moles, okay?
Yes.
Moles, even though they look okay, you know, moles can change color with repetitive treatments with laser hair removal. And we don't know if that does anything. We just don't have enough information. So
Right.
it's never a good idea to heat up cells that should not be heated up, you know?
Yeah.
So,
I'm
yeah.
very freckled. I'm
Freckles
redhead,
are,
so look at
yeah,
all that.
that's actually a good point. Freckles are okay because freckles are very superficial, but if you have one
Okay.
of those like birthmarks that are, you know, fleshy, or you know you have a lot of moles and you have a history of skin cancer, you go to your dermatologist, never treat those hairs with this laser, ever.
Okay.
Like, especially people who have hairs coming out of moles, don't do it.
Okay. Won't do
But
it.
freckles are okay. Freckles are great.
Okay, so I'm good. I'm good. I'm good
You're
to
good.
go.
Yep.
Okay, so MN Kala 18 says, should vitamin C or any other skin creams or serums be avoided? So what do we have to avoid before we
Great
do
question.
laser?
Typically, even for hair removal or any type of laser procedure that we do on the face, we always recommend to avoid a topical retinoid or anything that's going to exfoliate your skin for about a week. I personally do not think with this laser you need to avoid anything, but I would not put products on and then laser your face. Because if you're putting an acidic substance on over your face and you're going to heat it up, you could get a burn. So I would do this on normal skin with nothing on it, and then afterwards do whatever you want. You will see the goal of this laser is to not get an endpoint. You will not see redness or pimples or red bumps or, you know, you should not see that with this laser. I have not seen it, and I've treated my mom and my dad and my brother many times with this laser. And so you don't get that endpoint with this laser.
We do have the soothing gel that is used pre-treatment, which helps me a lot when I'm doing my underarms. If I don't use this gel, it'll burn me like more. So this gel it's got like aloe vera, I don't even know how to say this, guaiacylene. So there's a lot of really nice ingredients in this gel that help cool the skin down. I have to use this. I have to, or I feel like that snap, you know?
Yep. Yeah, so it's interesting that you say that because adding a cooling interface does work. I will say I would not recommend using other products that are probably not sold by the company because
Yeah.
you don't want to use something that's going to increase the amount of heat that you're putting through it. If you have an alternative, you could get, you know, ultrasound gel, which is pretty cheap. That also probably would work very well if you put it in the fridge and you leave it in the fridge. Again, this is just, you know, what we do in the office for certain things. You put it in the fridge and you can use it also as a cool barrier with the laser as a lubricating area and also to reduce the heat.
Got it. So this comes in a set together.
Awesome.
It's called the deluxe kit.
I didn't say this. I didn't get any money to do this discussion, by the way. So I'm just saying, like, and I always say this. I only talk about things that I know work. I refuse, you know, like I'm a sole believer in speaking by your word, and I'm telling you, my mom uses it, my dad uses it, my brother uses it, and it works. It really, really works.
I just wanted to let everybody know, I didn't come to him. He came to us.
Yep. And I was like, yes, because I do, like I said, I believe that there should be affordable options for patients. And I have patients who just cannot afford an office treatment. And this is a great at-home alternative that you can do in your convenience. You can do it in more body areas because you have the luxury of doing it at home on your own time, you know. I love it. No worries.
Should I shave before my treatment? Or can I have thin hair? With ours, you have to shave. It has to be a flat surface. The hair has to have a flat surface on it. It can't be a thin hair or else the laser might not be able to find it. Right?
Yep.
Yeah,
and I'll explain. Even if you go to the office, they will shave the hair, and I'll give you reasons why. If you have hairs at the top, you could actually burn your skin because the hair is targeted. It's going to heat up and it's going to cause your skin to get hot. So it could burn the skin, one. Two, it could also penetrate the laser from hitting the actual stem cells. So you really want to shave the skin. You don't just shave it right away. Even if you shaved it a few days prior, even a little bit of stubble is okay because it helps the target recognize that hair. Sometimes if there's nothing there, then you don't even know what areas are hairy. So having a little bit of stubble perfect is great, but you do not want like what I have here, because it's not going to do anything and you're going to get a burn.
Okay, so Bahara says also they've been to professional, they've had laser hair removal done in the office, but now they have thin hairs. Can they use this for a touch-up?
It's great for touch-ups, as long as the hair is pigmented, meaning it's black, dark brown, dark blonde, meaning there's pigment to it. Mm-hmm. Yes, the laser will work.
Okay. Susan is a big fan. Whoever Susan is, it must be your friend.
Love Susan. Social media buddy.
Awesome. So Susan's asking can they use a numbing cream before using the laser?
So, great question. I will tell you that for most numbing creams that are over the counter, like LMX, which is a lidocaine cream that you can get over the counter, any of those, the hemorrhoid creams, all of those that have pain-relieving lidocaine in them, it probably requires a thick dollop of cream because it needs to be thick and it needs to be occluded with like saran wrap for about an hour. So to me, it's a little bit unrealistic, and I'll be honest. I've done laser hair removal with injectable numbing and topical numbing, and for me, the hair follicles are so deep in the fat, they're in the fat. If it was in the skin, that's one thing, but the stem cells are so in the fat that I do not think it's worth trying topical numbing. And if you're going to do topical numbing, obviously you want to wipe it off and make sure the skin is dry before you do it. So I don't think it's worth it. I think you can try it. It might give you that placebo effect that you're doing something, so it could work.
Oh, okay.
But I personally don't think it's going to do much. You're better off getting ultrasound jelly and putting it in the fridge and using that as a cool gel and then using the laser through that.
Okay, that's a great answer. So I picked the winning question, the question that was posted on our Facebook post yesterday. I think this question, we kind of already went over it, but I think that this is a very important question. The winner, the person that I picked, is Farah Tihali. They want to know how to avoid acne scars and spots while using the laser.
Great question.
So how would you, like if you had spots, how would you go about using it?
Yes. So one thing you could do is if you have a mole or you have an acne scar is probably okay because it's normal skin. But if you have a mole or something, what you can do is you can take a white piece of paper and make a little circle cutout and just cover the mole. And that's what we do in the office, actually. If you have, we cut out pieces of white paper and we just block off the area and we put the laser on and you just make sure that you're targeting the hair and it will not penetrate through that paper because it blocks the light from. So you could do that. That's great. A lot of people use, what do they call those? The things that you put on, reinforcements like on the binder paper when it rips through. You can put reinforcements.
So the punch, the hole punch.
Yes. Yep. You can do like reinforcement stickers on the mole and then just do the hair in between. So you could do that.
Oh, I know what you're talking about. Those little circle stickers. Yes. So the paper doesn't tear. I got it.
Yep.
They sell those at the dollar store. Literally, You could just stick those on. That's a great idea. I love it.
Yep. And then we'll talk about acne scars in the future. About a different Yes.
So we are sending Dr. Lal our Smooth Beauty device. He hasn't received it yet, but when he does, he's going to test it out and come back to us and let us know what he thinks about that freckles laser for at-home use. You're gonna love it. I mean, look at me. I have big pores. I have scars from prior acne. I'm 44. Like I have to have this laser in my life in order to keep my skin nice and plump and glowing. So when he gets that laser, guys, we're gonna come back and do another video.
Absolutely.
So I'm super excited.
I love it.
I love it too.
Yep.
Well,
Yep. I actually got that same green device from my mom. You can see my post from I think Mother's Day this year.
Yeah, it was this year. It was this year.
Yep.
That's how I found you.
Yep. I gave it to my, and she's using it. I'm telling you, it works. It works. It's worth the investment. Really, if you're someone that wants to do this, and you either don't have the time. Oh, especially during COVID, you know how many people were like, I need to do laser hair removal. Places aren't seeing patients. I don't want to go during COVID time. I'm nervous. I'm like, this is your solution. This is easy. It's easy.
Yeah, and so I know that because I live in the Bay Area where San Francisco is. I live near San Francisco. So they're very limited on who they're allowing inside the office. We are getting new COVID cases every day, thousands and thousands of people. So in order to reduce the risk of getting sick, you get the laser delivered to your house and you can start right away. And by, let's say, fall time, when fall starts coming around, when you want to wear that cute skirt with the boots, you know what I'm saying? The little skirt. Your skin will be glowing, hair-free. Those legs will look amazing.
And it's good that you brought that up really quickly, because a lot of people, I wrote this, I was featured in, I think it was Elle magazine, or one of them.
Yes.
We talked about strawberry legs, okay? Strawberry legs occur from people who shave, right? And basically what happens is their hair follicles get, like, a little irritated, so people get that little follicular prominence. They get those bumps on their legs.
Yes.
Simple solution. Laser hair removal your legs, and you won't get those bumps. So,
yes.
And it's easy. You can just sit there, watch TV, and just do it at the same time. Like, it's really effortless.
Right. That's another one of the things I hear from customers. They say it takes too long to do one leg. And I'm like, well, you know what? When I'm in the shower, it takes me a very long time to do my legs. And I'm wasting tons of water. We're in a drought right now in California. And I received a message from, the water place saying you need to reduce your water usage by 15%, like right now. And I'm going, whoa, that means I can't shave in the shower or do anything like that anymore. So if I laser my legs, that's my goal to do this year. I won't be wasting all that water, or I don't have to buy those stupid replacement heads for my shavers. No shaving cream. I'll just be like, freedom. I don't have to worry about this anymore.
Yep. And on top of that, no razor bumps. And even just on top of that, I will tell you, even in-office treatment of large surface areas takes time. It doesn't take 5, it takes, if you're doing 2 legs, it takes 30 minutes,
Yeah.
And you're at the time, you're at the disposal of someone else's time. At least at home, you could maybe do 1 leg one day and then do 1 leg another day, Or make it like a fun task for your kids, like my mom did, and made me do her arms and made me do her legs when she's watching TV. I enjoy doing it because it's fun. I like that. I like the buzz thing. So for me, it's fun to do, but
get someone else to do it for you.
Yeah, it's true.
I'll make you dinner tonight if you do my legs or something like that.
Yep.
Yeah. So that's it for today. We have done it all. It's almost been 45 minutes. Can you believe it?
No.
Oh my goodness. Well, thank you so much, Dr. Law. Where are you located? You're in New Jersey?
Yep. So right now I am actually I'm in Hackensack, New Jersey right now is where I live, and I practice in Hackensack and Hillsborough, New Jersey, where I see patients. I'm doing, cosmetic dermatology and aesthetics. And then I also actually see children in Long Island 2 Saturdays a month, and I'm actually going tomorrow. And believe it or not, I do recommend this to kids who have hormonal issues with the PCOS, because I'm diagnosing it younger and younger. And those young patients, by the way, and I'm just saying this, are very vulnerable, okay?
Right.
And they do not like coming to the doctor as it is as a 14-year-old, let alone talking about the hair on their chin or their chest. And this has been a lifesaver for a lot of kids, especially people that are transitioning and are transgender. It's a really, life-changing thing. So I'm not just saying it from the perspective of a cosmetic dermatologist. I'm saying it from also a fellowship-trained pediatric dermatologist. Like this, you will see it. I'm telling you, it really is. So yeah, I work in New York and New Jersey, and I love it. Who knows where I end up though? I have no idea.
All right. Well, thank you so much. This has been wonderful. I can't wait to have you back again.